This comment is in regards to whether it's safe to use adenosine in somebody who is in a supraventricular tachycardia and also has a history of Wolff-Parkinson-White syndrome, or WPW. The take-home point is it's safe as long as the patient is not in atrial fibrillation, but let me address this comment. Let's talk about that delta wave first. This is a delta wave. It's that slur in the upstroke of the R wave. That delta wave is the impulse generated from the SA node getting to the ventricles too quickly. You see, that impulse travels down the atria very quickly, and that's because that conduction is mostly governed by sodium channels, which are fast channels. But once that impulse hits the AV node, then calcium channels take over, which are slow channels. This ensures that there is a brief slowdown in conduction in order to ensure that the atria and the ventricles contract asynchronously in order to give time for the ventricles to fill. In someone with Wolff-Parkinson-White syndrome, or WPW, that person can have a conduction pathway that directly connects the atria and the ventricles that bypasses the AV node. And that bypass tract is a fast channel pathway, so it will allow conduction to get from the atria to the ventricles almost immediately. So that's what you're seeing on that delta wave, is that impulse skipping ahead and starting the ventricular depolarization process just a little bit early. And this is known as pre-excitation syndrome. Now, that pathway only conducts voltage from the atria to the ventricles. That's what's known as an anterograde pathway. However, the majority of re-entry rhythms causing supraventricular tachycardias in patients with WPW are facilitated by retrograde pathways. With a retrograde pathway, that accessory tract returns voltage back up to the AV node. And what happens is an impulse gets stuck in that loop between the AV node, the bundle of His, and that accessory tract. And that causes the most common reentry rhythm in WPW, which is orthodromic AVRT. And that does not present with a delta wave because that's not a pre-excitation syndrome. So if you have a patient with WPW who is in a reentry supraventricular tachycardia, it is highly unlikely that you're going to see a delta wave. So the most important thing you can do with a patient who has a history of WPW and is in some sort of supraventricular tachycardia is think critically and follow your local protocols, not ACLS. Your local protocols trump ACLS. The American Heart Association is not a governing body. They make recommendations, but they try to make it as simple as possible in order to make it one size fits all, and it's not a recipe for critical thinkers. This is an educational channel. I'm not making recommendations. Follow your local protocols.